We can't stop aging. Aging happens to everybody, but how we age is very much within our control. And luckily, you've got somebody like me that can help you through that process. Now, one of the most common questions that comes up is how do our faces change as we age? And this is something that's been studied pretty extensively among plastic surgeons. That's what I'm going to talk about in this video. There are some very predictable changes that occur over time as we age. Starting with our 20s, that's really when most people have stopped growing. People tend to lose some of the baby fat in the face. Men will have their first fully grown beard that comes in. And really, it's more about prevention at this point. You do see some late 20-year-olds who come in for Botox, and that's really just trying to prevent. So in our 30s, that's when you're really gonna start to see the signs of aging. If you've had a lot of sun exposure, these changes are gonna happen to you sooner. But some things that you pretty predictably see, periorbital aging. So things like tear troughs might start to get worse in your 30s. There's patients in their 30s who will get a blepharoplasty because they really notice sort of some hollowing here. That's just the way you're born. And then when you continue to age a little bit, you lose some of that superficial fat. That's when it really becomes obvious. Other things that you'll notice are the forehead lines, glabellar lines, and crow's feet. Those become more obvious and may tend to be there even when you're not moving those muscles, so they kind of become set in place. Now, in your 40s and 50s, that's where you're gonna notice aging in everybody, regardless of how much sun exposure or how much skincare you do. Everyone's gonna have some changes with that. You're gonna start to notice some thinning of the skin. That makes those lines become a lot more apparent. You might also notice some lines underneath in the lower eyelid from smiling. Those are tough to get with Botox and fillers because they're really from the orbicularis muscle, this muscle right here. So it's hard to knock that out because you don't wanna make a droopy eyelid. So the smile lines out here you can definitely get. These become a lot more obvious in our 40s and 50s. And what you really see is a descent of the mid-face and the jowls, the lower third of the face. You see descent of the fat pads, you start to see a little bit of resorption of the bone, and so overall people just tend to look a little more deflated than they did when they were in their 20s and 30s. Another super common change that you'll notice is the upper eyelids will start to hood a little bit. And if you see that in me, I still have just a little bit of hooding here, but as I age, I'm gonna get even more of that. And this is a very, very common sign of aging. Now in the 60s and beyond, that's when you're really gonna start to get the really fine wrinkles that are hard to correct with surgery alone. Yes, facelifts, things like that will help with nasolabial folds, reposition the face in a more youthful appearance, but you're gonna have a lot more of these fine wrinkles that don't just come out with the surgery. That's when your lasers, your chemical peels are gonna be really helpful. You may also notice a lot of skin down here and descent of the brow as well. So things like brow lifts, neck lifts, facelifts are really gonna be the go-to in people in your 60s and up. And even before then, you can start talking about those things, but definitely everybody is there by the time you get to age 60. So just to prove to you that I'm not above making fun of myself, I'm gonna actually show you some photos of myself when I was younger. So here's a picture of me 10 years apart. Now, if you look at the photo on the left, that's from me at age 28. 10 years later, what you see with those arrows is that starting from the top, my hair is thinning. You see a lot deeper lines in the forehead, so I don't have any Botox on board. And you can see that now I have those lines even when I'm not moving my eyebrows. And in addition, the crow's feet around my eyes, I have some smile lines there. Even when I'm not smiling, you can kind of see those lines. That's really gonna be a good target for Botox if you wanna get rid of those. You also see very, very mild changes under the chin. You just see a little bit more fullness there. That also could just be how I'm holding my head. My chin is not sticking as far out on the photo on the right. But you know, you will start to see some changes, and then we all end up looking like our parents at some point. I've seen what my dad looks like. At some point I will probably have a lot more skin and kind of headed towards the turkey neck. But for now, I'm gonna pretend that that's not actually gonna happen. Now, here is a photo of someone that is probably recognizable anywhere. This is Jennifer Aniston, and she's currently 52 years old. She is one of the highest paid actresses on the planet and actually broke Instagram when she joined in 2019 because of so many people that followed her on the day that she joined. But here's a good example of a celebrity that she's aged here with some help. I mean, she's clearly looking great in her 50s. She really doesn't have any forehead lines, so she clearly has had some Botox there. It's pretty well known she had a rhinoplasty when she was younger. You can see the changes in her nose. She is looking up, her chin is up in the right photo, in the older photo, so that does change how we look at her brows a little bit. It looks like from the photo, it almost looks like her brows are higher on the right side. I think that's more just a function of how she's holding her head in the photo. But you do start to see a little bit of changes sort of around the eyes. You see those lines now, and a deepening of the nasolabial folds. Now, I can't do an aging talk without bringing up Paul Rudd, because he's basically achieved meme status when it comes to how well he's aged. But he's currently 52 years old, and you can see in the younger photo, I mean, this is back from Clueless. He's been in so many hilarious movies: Wet Hot American Summer, Anchorman, 40-Year-Old Virgin, Knocked Up, This Is 40, and obviously he's now Ant-Man in the Marvel Cinematic Universe. This is a great example of upper eyelid hooding and sort of that square jaw that as we get older gets wider. So you can see he had more of a heart-shaped face when he was younger, really cut sort of jawline. And then in the right photo, when he's older, you can see, I mean, he's got a very short beard, but there is definitely a little bit of widening in the jaw, a little more tissue sort of underneath the chin. The shadow's kind of hiding that, but you do see a little bit of that, and obviously the forehead lines and smile lines that I mentioned. Kurt Russell, currently 70 years old. This guy was actually super famous as a kid. He was a very successful child actor with Disney in the 1970s and was able to transition that success into an adult acting career. Escape from New York, Silkwood, Tango and Cash, Backdraft, Stargate, The Hateful Eight, and most recently he was Ego in the Guardians of the Galaxy. And his son, actually, if you look at the younger photo of him, Wyatt Russell, who actually was the new Captain America and US agent on the Falcon and the Winter Soldier, looks a lot like his dad. You can see there's a lot of similarities there, and if you look at photos of Wyatt Russell, it kind of looks like the young Kurt Russell. Here's an example of more advanced aging in a man. So you really see the square face now. He had a really good strong jawline when he was younger, but now there's a lot more tissue sort of around the jaw and under the neck. You start to see that turkey neck, that sort of skin laxity under the chin. You see a lot of upper eyelid hooding. It's almost hard to see his eyes. It kind of looks like he's squinting, but really that's just extra skin. And so that's something you could easily address with the blepharoplasty. I would be very hesitant to do a brow lift in a man. There's definitely some examples of this that have not turned out well, and I've talked about this in other videos. But here's a good example of a man who probably has not had a lot of interventions during his aging process and has aged quite well. Glenn Close, she's currently 74 years old, and she is in the top 5 for the most nominations of any actresses in history from the Academy of Motion Picture Arts and Sciences. She's an extremely versatile actress. She was actually named one of Time Magazine's most influential people in the world in 2019. And so what we have here is a really good example of more advanced aging in a woman. I'm not sure if she's had any surgery done, but you start to see some changes in the neck. So if you really look at her neck here, she has the smooth contour in her neck when she was younger. And on the right photo, you start to see a little more of those lines. So that's called platysmal banding. And that is where you really see the edge of the muscle. The platysma muscle is that muscle in the neck that gives us those lines. So the treatment options for that are Botox, or you can actually do a neck lift to address those lines and get you the smooth contour back. You also see she's got very deep nasolabial folds. You see the lines on the forehead, the glabella, the 11 lines on her forehead, which she actually had when she was younger, but a lot deeper now. And then the smile lines around her eyes. Betty White. So Betty White is 99 years old currently. She's an absolute pioneer for women in entertainment. She was the first woman to produce a sitcom. And then, of course, she became super famous from the Mary Tyler Moore Show and Golden Girls. The younger photo here, the reason I included this is because she's probably in her 40s when this photo was taken. And what you see is that currently, people in entertainment in their 40s don't have any of these lines, and that's because now we have things like Botox and fillers. And so you see some periorbital aging. You see the smile lines, the crow's feet. You see a little bit of bunny lines. Those are the lines sort of along the nose there, between the eye and the nose. And obviously she's quite aged in the photo on the right, but this is a really good example of how, you can age gracefully, and I don't know if she's had any surgery, but some of the changes that you see, the drooping of the nose, the deepening of the nasolabial folds, and the skin laxity under the jaw and the chin, these are pretty common characteristics that we see as we age. So I think that covers it. I'd love to hear from you. What questions do you have? What didn't I answer? What would you love to hear me talk about? Let me know in the comments. If you learned something, throw the video a like, and I will see you guys in the next video.